Well, thank you very much. And yeah, last is always good because everybody has said everything that I was going to say. So yeah, but I just thought we should maybe orientate ourselves on what is actually happening in Africa. So I'm David Katerere, and I am at Tshwane University of Technology. But again, I have to be cautious because Africa is not a country. We tend to talk of Africa as a country. It's 55 countries, over 2,000 languages, so many cultures. So whatever I'm going to say has that caveat to say it probably represents most of what Africa is doing. We know then that Africa is very rich in plant diversity. Not just our own plants, but also plants that are, by the way, naturalized to Africa. But we start to grow them like, guava or ginger, allium sativa. We have very good land here. And one of the things then is that we can export to the world, but we're not doing that. We've also got our own really good indigenous products that are coming up here. Artemisia afra, someone talked about it earlier. So we have all of that. However, we have sub-industries because what we have is in the herbal market, we have people who are selling on the street, right? And this is important because it's about access to medicines. And then increasingly, we have people who are now making products of this nature, artisanal in some form. But believe it or not, these are some of the best-selling products, particularly in Southern Africa. And then, of course, using some of these ingredients, we now have more upmarket products trying to get into, very niche markets, as it were. And then, to top it all, we now have cannabis, which kind of throws a lot of the things that we have built and known, over a long time out of the window. It's a real challenge, cannabis products. And that's something that we will need to be thinking about. So the status quo says natural is safe. Actually, Kopano says it's my culture, therefore it is safe. But it is not. A lot of these things kill in very small doses over a long time. So if you think about aflatoxin, exposure to aflatoxin, for instance, it's very small amounts, chronic exposure to small amounts, and then you end up with liver cancer. So natural or culture is not always necessarily safe. There's also a lot of adulteration of products. There was a talk earlier about the Belgian clinic. That was misidentification, but we also see like diet pills that are adulterated with things like sibutramine, pharmaceutical products. And in fact, this led to the deaths of a few people in South Africa. Misidentification, whether it's botanical or chemical identification, is a big issue. And then for us, a lot of our products are coming from China and from India, and there is no proper supplier qualification. So we actually don't know where these products are made. Yeah, there are information gaps. So and on the packaging, they always say, ask your pharmacist. But hey, we train pharmacists, they really don't spend too much time getting to know these products. We've done some work actually around mycotoxins and aflatoxin. And what we found was that they might have aflatoxigenic culture in them, or bacteria, or fungi in this case. But then they don't, in South Africa in particular, because South Africa is not aflatoxin area. However, the biggest problem is that a lot of these products are stored in maize bags. So if you're in Kenya, which is, a high aflatoxin area, or you're in the tropics in Nigeria, because these products are stored with maize or in maize bags, they're then likely to be contaminated as a result. So what's the state of play? In general, in Africa, whether you're in South Africa, you're in Nigeria, or Zimbabwe, the Congo, there's lack of standardization, right? And part of it has to do with lack of laboratory facilities. And then, of course, there's also then lack of facilities or awareness of phytosanitary standards or support for phytosanitary standards. And this actually impedes trade. So we cannot export a lot of these products that are based on African indigenous plants or even those that are grown in Africa. So that's one of the issues that we battle with. And there's a lack of regulations in most of the countries. And those countries that have regulations, I would say they're over-regulating, right? So there's almost a requirement to have CTD dossiers submitted to be able to register products. And that's just really an overreach because a lot of this industry is informal. It's survivalist in its outlook. There's also the magical spiritual aspects of it, which are important. And then, of course, cultural. And sometimes it actually goes into the political. Some people believe that you should not regulate this because it is our cultural right and we have certain political rights to be able to use these plants, but also sometimes to sell them. And the other thing is it's entrepreneurs. So a lot of people in this area are not trained as scientists. They are risk takers and entrepreneurs. So in coming up with regulations, we need to know who we're dealing with, and then we need to be sensitive to that. So certainly the Health Canada presentation was interesting, but would it work in Africa? That's one of the questions that we need to ask. And then what needs to be done and what is being done? Well, we need standardization, and this is why the Association of African Medicinal Plant Standards comes in. We actually have an African Herbal Pharmacopoeia, and if you send us an email, we are happy to give you to give it away, this particular one, and we are looking for contributors for the next version of this, which will be published in the first quarter of 2023. The other thing is training, which is where PharmaConnect Africa is involved in. You'll see that when you go to our website, there's a whole series there of content that we have curated and is free to use. So we're looking to build partnerships and also get funding so that we can continue to give this product out. And then research that supports industry. So with CSIR in South Africa and Tshwane University of Technology, we've actually imported and installed this piece of equipment, which is a carbon dioxide extraction piece of equipment. And now we are inviting entrepreneurs to work with us so that we can do extractions for them and also then be able to standardize those extracts. I must hasten to say it will not be free, but it will not be expensive either. So what's the starting point? I think one of the things we need to think about is separating the practitioner from the practice. In Africa, the practitioner is the practice, is the product, and the product is the practitioner. And then industrialization. This is controversial, but we know that if we industrialize a lot of these processes and also we industrialize products out of it, we start to see professionalization of services. We start to see pharmaceuticalization. That's a word that I made up. In other words, we start to put things into dosage forms rather than just leaving them out or just putting them out as decoctions. It also then means that it begins to make sense from a business perspective. The other thing is to have appropriate regulation, not just any regulation. It has to be appropriate to the practice, to the product, and to the premises. And when you look at the history of medicine, this is actually what happened, in Europe, starting in Europe, where they started to separate out practitioners, and also they started specializing as practitioners. And then the product, where it went into the hands of specialists, as it were. Okay, so to conclude, what do we need? We need a multidisciplinary approach. So having everybody here, this is not for medical doctors, it's not for scientists, it's not for doctors of any sort. It's really for anybody and everybody who plays in this space. So you're welcome, and please reach out to us by email. And then we need to invest in African traditional medicine science. I call it ATM science. We need to do that. We need to learn from what other people are doing. And this webinar has been part of that learning. And then we really need to start to take small steps. So with that, I'd like to thank you very much.
So much. Thank you so much, David, for that wonderful overview and some recommendations. This has been a great session. I'm sure all of you have enjoyed. We've gone quite a bit over time, but I think it's worth it. So there's only one question that I saw on the chat that we can probably listen to, or rather answer. And this was directed to Nana, Mr. Buffy Ebo. There was a question about how does Health Canada differentiate between drugs and dietary supplement. I'm just rephrasing that. So if you can answer that, and then we can see what next.
Absolutely. So basically, the definition of the dietary supplements would be comparable to what we consider natural health products. And the basis of it is that it has to be naturally occurring, and it has to be something that you can find in nature. So it's still a drug, but it has to be found in nature. Whereas the other drugs, the non-prescription drugs, are things that do not exist in nature whatsoever. So that's the real defining line. In that a natural health product as a substance is something that exists.
Great, wonderful. Thank you so much.
Helen,
well, yes, go ahead.
Let me just add a little bit of complementary information to that. Nana and I have in our organizations a group that also tries to figure out that borderline between a food and a natural health product, because indeed it is challenging. There are many gray area products. And so we do have some guidance online, just as the US FDA has guidance on beverages versus dietary supplements. We have guidance on those gray area products between foods and NHPs, where the form is part of it. You know, whether if it's in a dosage form, typically it will be an NHP, although of course many candies look exactly like a pill, so that is not the only criteria. So we do have a set of criteria. We look at the dosage form, how it is represented for use, the history and perception of the public. If it's something they're used to seeing as a food, that's a consideration. If they're accustomed to seeing it more as a medicine, you know, we take that into account, because there's no point classifying something that's totally different from the way the consumer sees it. That creates a challenge of itself. So we are happy to provide the link to that guidance. But yes, Nana and I have a team of people who work on this very question, because it is quite challenging.
Great, that is a good clarification. Well, we've come to the end of this wonderful session, and I'd really like to thank all the speakers. They've done a great job, and I'm sure that I've seen a lot of questions here and comments asking for another session like this, and definitely we are going to work on that. I look forward to a lot of collaboration coming out of this, and we'll make sure that you get the presentation that you are asking for. So a round of applause for our speakers. I will do that myself here. So have a good day, good evening, good morning. Until next time. Back to you, David.
Thank you very much, Helen. That was fantastic. And thanks to the speakers. I do think that out of this will come more, because I think, you know, it was a real squeezed, but it was important. And I think we need to now think about going forward, maybe courses that we can have, or future talks, and also just collaborations that we can forge. So I'd like to thank you, Helen, for leading this. Robin, for all your storytelling. I hope you should come. Well, I was hoping you would come south next time. You seem to have stayed up there. Amy, thank you very much. Connie,
they already left. They had another meeting.
Oh, okay, yeah, but okay. So I think it's very important. Michelle is still here, so thank you very much. At least you're just across in Malawi, so yeah. Amy, for your industry perspective, and Nana, for that Health Canada regulatory perspective. I think it was a very rounded webinar and very rich, and I'm sure that our audience has enjoyed that. Again, you can just follow us on socials, send us emails so that we can give you the presentations, and also for the recording, which should be ready in about 10 days time. So with that, keep safe and be well.
Don't worry, I'll bring all of them.
Okay, that's good. Let's have a face-to-face next time.
Yes, thank you very much.
That sounds wonderful.
Okay,
Thank you so much.
Great, thank
Bye.
you.